It increases risk for cardiovascular disease. What are they? Well, number one is high blood pressure. That increases risk for cardiovascular disease. The other one is diabetes, high blood sugar. That significantly increases your risk for cardiovascular disease. The next is visceral fat, which is fat in the abdominal area. That's a strong risk factor for cardiovascular disease. And then hypercholesterolemia, elevated lipids, elevated cholesterol, which also can drive up risk for cardiovascular disease. And so in this analysis, in these 12,500 adult men and women, those that strength trained less than an hour a week were 29% less likely to experience metabolic syndrome. So what we're saying here is that brief, infrequent strength training was effective at lowering blood pressure, was effective at lowering cholesterol levels, was effective at decreasing visceral fat, and it was effective at increasing insulin sensitivity so that blood sugar levels were also lower. So across the board, we have a powerful risk reduction from that strength workout, again, less than an hour a week from that strength workout, that translates into lower overall risk of a stroke and or a heart attack in your lifetime. Now, this seems to make sense. If you know anything about strength training, you know that it has, again, those direct metabolic benefits that it provides every time you work out. As we call this an acute response. And then some of that is due to the training response, the chronic adaptation of having more muscle and how that changes your physiology. But there's really two levels. It's the immediate benefit of the workout itself, an acute training response, and then there's a chronic adaptation, which again, further enhances the health benefits. And you're seeing that when I talk about risk reduction for metabolic syndrome, which is a major issue in the United States. Now let's pause for just a second on diabetes. Why is it that a strength workout would lower blood sugar? This is not what we've thought about traditionally. I'm going to quote a renowned researcher, Dr. Timothy Church at the Pennington Biomedical Center in Louisiana State University, LSU. He says that your muscles chew up massive amounts of glucose, which is blood sugar. Your skeletal muscle is the primary tissue where we store blood sugar. So if you're aging and you're losing muscle because you're not strength training, the tissues that your body has to store glucose, to store sugar, is decreasing. And so what ends up happening? It's inevitable that more blood sugar stays in the blood because it can't be tucked away in the skeletal muscle and be used at a later time. So the more muscle you have, the larger the storage tanks are for sugar, i.e. glucose, and so that helps to clear glucose out of the blood and keep blood sugar at healthier levels that aren't in that diabetic range. And so it's a very potent and direct way that strength training helps to reduce the risk of diabetes. And again, when you're a diabetic, you're a little more than 2 times as likely to suffer a cardiovascular event. So anytime we lower blood sugar, it's a win for diabetes, it's a win for heart disease at the same time. So our second point was that same short, less than 1 hour a week workout can also reduce risk significantly for metabolic syndrome. Visceral fat goes down, blood pressure can be decreased, cholesterol can be decreased, and glucose can be decreased. So these are all major victories for both heart disease as well as cerebral vascular disease, which includes your brain and risk of having a stroke. And number 3 here is that same workout, that same less than 60 minutes of strength training in 7 days can also reduce stress on the heart and the cardiovascular system in general. Anyone who lives in the Midwest has heard before that if you're over the age of 50 and you go see your doctor and winter is coming up, they may sell you to don't go out and shovel heavy snow in the winter. Now why is that? That's because if the average adult who's not strength training, who's not very strong, goes out and tries to shovel heavy, wet snow, they're putting an enormous amount of stress on their heart and their cardiovascular system. That, of course, can and sometimes, unfortunately, does lead to a heart attack, and in some cases, fatal heart attack. So your doctor might say, don't go out and shovel in the winter, go buy a snowblower or have someone else clear the snow for you. Now, is this really because shoveling snow is bad, or is it because of your cardiovascular system's stress as it relates to your muscles? It's about the muscular system, guys. The snow's got nothing to do with it. If you put your body under any significant demand and physical stress, and you're in poor health, you're setting yourself up for trouble. One of those things, of course, would be a cardiovascular event, such as a ischemic event, such as a heart attack. And so how do we fix this? Again, that same workout we've been talking about, less than an hour a week. In our case, it's 2 25-minute workouts here at MedFitness. But 2 full body workouts a week makes you functionally stronger. And when you're stronger, what we're doing is we're reducing the stress on the heart. Now, why is this? If you go out to do some physical labor in the winter, or any time of the year for that matter, and each muscle fiber is limited in how much force it can generate, you need to use a lot of muscle fibers to perform demanding activities. I'm a great example. I can go outside, shovel snow 10, 15, 20, 30 minutes, work hard, not be out of breath, not be sweating, not be fatigued, not have a cardiovascular event. And the reason for that is because my muscles are stronger. I don't need to use as much of my muscle tissue because each motor unit, which is a bundle of muscles and a motor nerve, each motor unit generates more force. So because I'm stronger, I don't need to use as much of my muscle tissue. And that means that's less stress on the heart, it's less stress on the cardiovascular system in general, and less risk of, again, adverse outcomes such as a cardiovascular event, whether you're shoveling or doing something else. So muscle weakness contributes to the problems that we see with these cardiovascular events because your heart is stressed when we demand a lot of it. Being stronger simply decreases the workload and the stress on the cardiovascular system because you don't need to use as much muscle tissue, you don't need to use as many, we call it motor units, but you might say as many muscle fibers. And so this is incredibly good news. So let's recap this here. We've said that in less than an hour per week over this 11-year period, this was the follow-up time, 11 years with these 12,500 adult men and women, they saw a 40 to 70% fewer strokes and heart attacks in those who were strength training, less than 1 hour a week. Unbelievable. In fact, there's no drug, there's no intervention even comes close to generating that outcome. That same workout, that same, again, in our case, 2 full body workouts, less than an hour a week, generated a 29% reduction in metabolic syndrome. What is that? Less visceral fat, decreases in blood pressure, decreases in cholesterol, decreases in lipids, in glucose. And so that's incredibly good news because those drive up risk for heart disease exponentially. And lastly, being stronger gives you a break because it puts less stress on the cardiovascular system. Being stronger means that you don't need to use as much of the muscle tissue you have, and so there's less demand for oxygen, there's less demand for energy and nutrients to working muscles. It makes everything easier and lowers the stress on the cardiovascular system. So 3 levels of very meaningful health benefits, cardiovascular benefits, to anyone in this group who happen to be strength trained for less than 1 hour a week. Now, here's the footnote that is going to surprise a lot of people. When they compared the folks strength training less than an hour to the people who were strength training significantly more than an hour, there was no greater benefit to those people who did significantly more strength training. So doing more workouts and having longer workouts did not translate into any more cardiovascular benefits. This is incredibly good news, especially for our clients at MedFitness who are here training 25 minutes twice a week. You might ask yourself, gosh, maybe a third workout would be even better, or maybe a longer workout would be even better. In this case, for America's #1 killer, the sweet spot was under 60 minutes, which is exactly what we're doing here at MedFitness. And so this is incredibly good news for anyone who's living the strength train lifestyle and training at MedFitness, for anyone else out there who has embraced the strength train lifestyle on their own and or with a different personal training program. Now, I want to summarize this evidence by quoting the lead author of this investigation, Dr. D.C. Lee. He's in the kinesiology department at Iowa State University. I'll say exactly what he was published. He says that in the United States, strength training is underappreciated. Now think about that for a second. Let me say that again. That is a critically important statement to the medical community as well as people in general. In the United States, strength training is underappreciated. He's hit the nail on this one. So what we're going to suggest is an action step, and I'll give it to you in 2 seconds here, as a way of beginning to appreciate the real value of strength training. This is not a behavior that you want to say, well, I'll think about it, I'll get to it down the road. By the way, guys, I forgot something here. These people were not meeting the aerobic exercise guidelines. Think about this for a second. For 50 years in America, the gold standard for risk reduction and in cardiac rehab programs, the gold standard was quote unquote aerobic exercise. Get on a bike, treadmill, do things like this. We're not saying that these are counterproductive, but that was the gold standard. These people in this study who got these huge health benefits, they weren't doing any other physical activity. They were just strength training, something we would have never expected to see 1, 2, 3, 4, 5 decades ago. So again, this is the opposite of what doctors would have thought and recommended 1 generation ago. And so, in the words of Dr. Lee, yes, strength training is underappreciated. The way to change that is to get into action with the strength training lifestyle. So congratulations goes out to all of the MEDFITNESS clients who are getting in hundreds and thousands of workouts that we see here every month at MEDFITNESS. Great job, guys. Keep up the great work. My take-home message is simple. If you're living the strength training lifestyle, keep living it. It is more important than you realize. Yes, it's a feel-good behavior, which is great. It increases functional capacity. You can do a million things because you're stronger, and that's all good. That enriches the quality of life. But it is very possibly the single most important thing you can do in your life to reduce your risk of experiencing a fatal heart attack is to make sure you are living the strength training lifestyle. So keep strength training, guys. Keep doing what you're doing. If you're not strength training, you saw this coming, right? Embrace the strength training lifestyle. Now is the time to begin to protect yourself and to lower your risk for a serious cardiovascular event. I mean, no one ever said that, well, I had the heart attack. I'm really glad I didn't strength train over the last 5 years. Nobody's ever said that. So now is the time if you haven't had an event. And by the way, most people who have a cardiovascular event or a heart attack are at high risk for a second and or a third. So even if you've had the heart attack, it is not too late to turn the tide and begin to get the benefits the strength training lifestyle has to offer. Now, if you're not at our studio here, and if you don't have a trainer or someone to help you, I'm going to recommend you go to our strength guide, which is at our learning center at medfitnessprogram.com. If you go to medfitnessprogram.com, you'll see the learning center at the top of the website. Click through. It's the first resource. That's our strength guide. It gives you some of the basic fundamentals of how to begin strength training with some structure and some guidelines, as well as links to other articles that we've written on the how-tos of strength training, as well as some videos that will help guide you through your eating habits as well as your workouts at the same time. So this is good news for all of us. Keep strength training if you're strength training. It's time to begin living the strength training lifestyle if you haven't done it. I appreciate your time. Thank you for being here tonight. I will see you next time.